Welcome to the Jaros Health Podcast, where we make it easy for you to better serve older adults through our content that informs, community that inspires, and courses that deliver.
Hey everybody, and welcome to Home Health Recharge. This is Troy Mead, your host, and today I'm speaking with Sean Hagey on the importance of Oasis and professional and paraprofessional collaboration. So, Sean, you are a PTA, but you also have your Oasis certification. Is that correct?
Yeah, COSC.
Mm-hmm. I have that one as well. We are COSC brothers, I guess. So,
all right.
I'm up for renewal, so I got to take that again. Boo. But it's all right. I guess suck it up and take the test. So what encouraged you to get your COSC?
Yeah, I really enjoyed treating patients, but I'm kind of the type of person who likes to try new things. And so when opportunities come up for, like most agencies, they do some quality assurance as just part of the regular routine amongst the staff. And I found that I kind of had a knack for it, maybe an eye for catching patterns. And an opportunity opened up for me to learn more about auditing the Oasis itself, not just regular documentation. And there's just, it's, in one sense, it's not all that difficult because most of the errors that people make are errors of, they're hurrying and things aren't, they skip things or miss things or accidentally put a different error in. I found that was kind of a niche that I could fill that was easy for me to do and actually kind of fun too.
So with the new COPs, I know they strongly encourage some collaboration between different disciplines, as well as collaboration on the Oasis between professionals and what we would deem paraprofessionals, the LPNs, yeah. PTAs, CODAs. So is there any benefit for a PTA to understand the Oasis in the field?
Yeah, absolutely. The one of the main things I see in auditing is, you're limited on time, and even though the Oasis is just about the most complete evaluation that's done in healthcare, period, you're still only seeing that patient that day, and sometimes you're just not able to get all the information. I know as a PTA, it's happened way more times than I could ever count, that when I go and see the patient for that second visit, like let's say it's just a PT, a therapy only start of care, and I'll see that patient that second visit, and they'll immediately say, "Oh, I forgot to tell them," during the eval this, like a certain medication that they're taking that wasn't available, or something from their medical history that, since I know that, coding is important, I can be like, oh, they actually have a history of this also, or sometimes all the physician documentation isn't there at the visit, and they'll have found extra papers since the start of care. There are just so many instances of that where I can contact my supervising PT and say, hey, Mrs. Jones forgot to tell you that she, also has a history of, X, Y, or Z, that are, isn't just kind of trivial information, but is also a lot of times, really important for that Oasis stuff as well.
Mm-hmm. I think that's definitely true. It's very hard to cover everything, I mean, and it's really easy to miss a few things, especially things that sometimes, are important as well. And having
and then sometimes for that start of care, I'm sure you've been there. Maybe the caregiver isn't, maybe the primary caregiver in the home isn't available for that start of care, and then I'll see them the second visit, and the caregiver will pull me aside and say, "Oh, by the way, they are incontinent. They're just embarrassed to tell you last time that they have some issues with that." And that's common. People can be kind of embarrassed about disclosing information, or they might not think it's really that important and kind of just brush it off, and then inevitably the caregiver, like the daughter, will pull me aside and like, actually they, they'll be able to provide a little bit better clarity of information as well.
Do you think if there's other certification programs for the Oasis, so I'm not just going to focus necessarily on the COSE one, but just in general, having more knowledge on the Oasis as a PTA, do you feel that helps your practice and kind of helps you to be able to identify what might be more pertinent to communicate to the therapist?
Yeah, absolutely. Since you know what the major questions are when it comes to the Oasis, you can give that feedback appropriately. For example, perhaps that the 1860 ambulation one, maybe they were absolutely non-ambulatory for that time period, but you can see that they actually are ambulatory. On your second visit, that's information that you can give back, and then it's inevitably up to the PT to decide what's relevant or not. But you since you know what the Oasis is asking, you can comment directly on those things like pain and dyspnea, vision, and all those other options that are really pertinent to the Oasis, and knowing that you have that 5-day window for collaboration is important, because the more eyes that you can get on it, we're talking about even other disciplines. Therapy will get in there, and maybe nursing isn't really sure on some of the functional options. You can have therapy come in later and say, yeah, I think that these 1,800 items would maybe be more appropriately marked this. Inevitably, it's the person filling out the start of care, but the more information that you can have, the better you can get it right that first time, because as we all know, that if you're really haphazard on your start of care and inconsistent, then when it comes to discharge, you might be making yourself look way worse than you really are. I think anybody who's audited Oasis will notice that trend is, if you're in a hurry and you rush through the Oasis and you get it wrong and show that that patient is way better than they are, you're only hurting your agency and yourself, because that patient will get better, and you're not going to get any credit for it because you didn't document it properly. So, I mean, those are just important things to keep in mind. I know the Oasis really bores some people to tears or makes them get a twitch in their eye when you say the word, but it's an incredibly important thing that we get right.
Yeah, you're exactly right. And, to be honest, those, when you hear talk about value-based purchasing or value-based healthcare or 5-star ratings, and how we're comparing everybody to each other, when it comes down to it, the Oasis is really what, without saying it bluntly, that's what counts.
Yeah, I mean,
outside
if
of
you
claim.
do, it's like documentation in general. If you provide really great patient care and the patient gets better, but you didn't document it correctly, then as far as Medicare is concerned, you didn't do anything right. So, I mean, we all wish it was different, but if you don't document what you do and prove your value, then you'll be shown to not have any value. It's as simple as that. And we know from like the value statement and a lot of research that we provide a lot of value. But if we can't document that correctly and show that, then therapy will be in danger of further cuts in the future. I mean, it's up to us to show that we're valuable and what we bring to the table.
Exactly. I mean, I don't think anyone outside of maybe Cindy Kraft says that they love the Oasis.
I tell you what, I've fallen in love with the Oasis manual. It's crazy as it sounds. CMS is basically giving you a manual on how to score it, and so if you don't score the Oasis properly, I think they pretty much can just tell you, hey, we've given you all the tools. It's amazing how many clinicians I know have never even looked at the manual that explains how to correctly score things, because a lot of the errors that I see are like, I want to say, dude, like literally it's spelled out for you how to answer like some of these 1,300 items. And if you get those wrong, then you're really missing out on stuff. But I guess such is life for busy clinicians who would, we'd all rather focus on patient care and getting patients better. But it's also important that we get the documentation right as well.
Yeah, I want to stress that one of the advantages of going through some of a certification through Oasis is learning a little bit more about it, and also reading the manual. That's always good to help understand things, because it is not. You don't come out of PT school or nursing school knowing how to score the Oasis. And there are little nuances to certain questions that if you don't understand, then they can kind of hurt you in the long run.
Yeah, in the end, it's a data collection instrument. I've heard Cindy Kraft say that so many times that I think I dream about it now. It's not a therapy or nursing tool. It's a data collecting instrument, because Medicare wants to see trends and how patients are doing and how they're getting better, and they want to identify especially key things like patients that have heart failure and COPD, who's getting better and why, and demonstrating what's improving and what's not improving. So they're looking for consistent data, and if clinicians aren't filling it out correctly, it makes the data look skewed and inconsistent, and it is a big, huge red flag.
Exactly. And I want to throw the hot topic in here that is always the hot topic here recently, PDGM. So, there's a lot of misinformation running around about PDGM, and there's a lot of accurate information as well going around. But I think at least the one thing that's going around that's going to be right on the money is, we're going to continue to look at what value outcomes, are placed in home health, and going away from the amount of visits. With that said, do you feel that the Oasis will be an accurate scoring of the Oasis in addition to coding? We all know that coding is going to be very important. And you kind of touched base on it a little bit with PDGM, coding and and Oasis accuracy is going to be even more important to, especially the therapist, to show value in the future. Do you agree with that statement?
Yeah, absolutely. I mean, part of me is really excited about this transition because, I mean, if that M2200, if you're doing 20 plus therapy visits, but the patient isn't getting better, I mean, I can understand why Medicare would say, "Why are we paying you for all these therapy visits if if the patient isn't getting better?" That's a question aside from maintenance therapy, but that's not how you do maintenance therapy. True maintenance therapy. There are, as we all know, there are plenty of agencies that game the system and just try and maximize therapy visits because they make more money, and it's not really about true patient care and what's best for the patient. Unfortunately, things like PDGM will kind of swing the pendulum another way, and probably some of those same agencies will make drastic cuts to therapy since they're not going to get the extra bonus from all those visits. But we all know that means that patients will suffer, and now their outcomes will drop, and in the long run, that will be a real drastic failure to those agencies for their short-sighted kind of knee-jerk reaction. At the last CSM, we were fortunate to have representatives from the government, from CMS, and they said that therapy is obviously just going to be just as important as ever, but it's going to be more based on outcome. So it's going to be a rocky transition as we try and find that balance. But in the end, the outcomes are what's going to matter. So if you can get that patient better in 5 therapy visits instead of it being 17, then you're going to do well as a therapist and an agency because you saved the system money, you've gotten the patient better, which was the goal from the beginning. The goal wasn't a bajillion visits, it was just to get the patient better. And so, I think the thought is right in putting the incentive instead of on more visits. The incentive is get the patient better. I guess that maybe that's the optimist in me. Kind of seeing that's what healthcare should have been all along. Especially, I hope that we can find a good balance and in a way of making it work that kind of spreads out to not just home health, but and all the other sectors of healthcare. Incentivizing the structure so that patients get better. You wouldn't want to go to an auto mechanic and if you're going to have them change out a part for you, but they keep doing it wrong, but you have to keep paying them each time they do it wrong until they get it right, you would be really frustrated. You're like, I paid you to do this job, and once this job is done, then you're done. There's so many things in life where the healthcare model that we use right now is just kind of mind-boggling how we got here in the first place. So I think part of the change in value-based care is to put the focus back on, like, are we getting patients better? And let's just focus on that instead.
Yeah, I think you're right. I think, obviously I have a lot of faith in the power of physical therapy, especially with, all the research articles that's been done by our one of our champions, Jason Falvey, as well as others, especially in the home health, on that physical therapy or therapy in general in home health results in outcomes. That I think we're in that spot now that it's always a transition phase where it's kind of scary that now we're in the spot of, what's the right number, and then getting the payment right with that. So, hopefully, as we all continue to use our voice with CMS when things come up, and as well as, just are involved in making sure in our companies too that we know that they know our value outside of, value outside just making the visits, that there is, we make a great impact on our patients on where it counts. So.
Yeah. And one thing to keep in mind is, Jason has noted in some of his research, is therapy, believe it or not, for all the times that therapy is overutilized, where actually therapy in general is underutilized in home health. I'm sure you know and have seen, and I've seen just countless times where a patient clearly would benefit from therapy to keep them, healthy and out of the hospital and avoid rehospitalization, but they just refuse it. They just want nursing. And so part of the future of our profession it has to be, helping those patients that would actually benefit from us, and showing our value and showing them, hey, if you want to avoid getting in the hospital again, part of this is going to be, getting you better and more mobile, so that way you can avoid falling, or you can, be healthier as well. So I think with the one pendulum swing, we have the opportunity to actually provide, there might be less visits in one case, but there might be more visits in other cases as well, where we can, provide more care to people that need it.
Yeah, it'll be how do I want to say this? It's always one of those tricky things where I don't want to sound super negative, but sometimes, when you don't have the room because you're making so many visits with one type of patient, that you don't have room, and you don't force on anything, but you kind of easily take the I don't want it right now, you know what I mean? Or you don't try to show what you can do as much because you're overloaded, and it's just life type of things, you know what I mean? If you don't have that room, then it's easier to take no for an answer, as they would say, without trying to show what your value is. You know what I mean? I think in the future we're going to have to get a little bit better at verbalizing that to not only patients, but also to the public, as well, and to physicians and stuff like that we can help, not only this frail, a non-frail patient, this person who has who's on the edge of going to outpatient, you know what I mean? Mm-hmm. That they have all this potential, but also these frail patients also, have potential as well, just in a different way.
Yeah, and that comes back to just one of the problems we have with PT in general, is nobody knows what we do as therapists. They just see it as exercise only, or they see it as, you're going to make me miserable. Yeah, or, and they don't realize that, we're there to actually help them achieve their goals. And I think, any of us who have worked in this profession for a while have had those patients who were really apprehensive about it. But then as you got started and they're like, wow, I'm feeling better, and I don't need my oxygen as much, and I'm able to get around more, and they're really happy because now they're able to start to get a little bit of their life back, and they didn't realize that therapy was the key to that. They just saw it as somebody's going to come in here and make me stand up and walk around the house, and I don't want to. But instead, therapy is we're just little guides on the way to helping them be, meet their goals and get back to doing what they want. So yeah, part of our job as therapists here in the future is going to be to educate, not just patients, but also the referral sources on what we can do to help these patients, keep them out of the hospital.
Thank you for listening to the Jaros Health Podcast. Go to jaroshealth.com to get the show notes for this episode and find out how you can join the Jaros community for free. You'll get access to our private Facebook group and the weekly Jaros recap, where we share our favorite reads, podcasts, and any interesting conversations in the Jaros community that week. Once again, that's GEROS health.com. Thanks for listening.